Good morning. I'm Dr. Scott Brady, and thank you for joining us again for AdventHealth Morning Briefing. I'm so excited today to welcome Dr. Mike Cacciatore. Dr. Mike Cacciatore is the Senior Medical Director of AdventHealth Medical Group. And Dr. Cacciatore, welcome.
Well, thank you, Scott. It's good to be here, Dr.
It's
Brady.
good to have you. We're here on Tuesdays and Thursdays to answer any questions that the folks might have, especially around COVID. So you are the medical director for the AdventHealth Medical Group. What does that mean? What are the things you have to oversee?
Well, that's great. The Chief Medical Officer for the group. You know, I could tell you lots of things. We can talk about quality care for patients. I make sure that that's done. I make sure our doctors have what they need to do their jobs well. But I think the best description of a good CMO is I care for the people who care for our patients.
That's good. Now, how many physicians and providers do you take care of?
We have 1,200 providers. We are the largest medical group in AdventHealth for the country.
And it goes from Flagler all the way to where?
So we actually go all the way out to Polk County.
Okay.
We come in through Celebration, all of the central Orlando area, and we actually go all the way up to Waterman, too.
Okay.
We also have another division that sits out towards Flagler, and we call that our, quote, North Division. And that's got Flagler, Daytona, DeLand as well, too. And there's another 250 providers there, too.
All right, so 1,200 doctors, that's a lot of physicians to oversee. We're going to ask a lot of questions today. We'd love to answer your questions. So you can ask a question in the comment section or text us at 407-490-3075. So Dr. Cacciatore, when you guys were preparing for the COVID surge, what are some of the things that the medical group did to prepare for that?
That's a great question. It was kind of a scary time for all of us a little bit. It was so new. We weren't sure, are we giving the right protection? We made sure we had the right equipment to protect ourselves and our patients. When we looked at it and said, okay, we really need to know how we're going to approach everybody. We like to approach them the same way, so that if, for example, you came to visit me and we thought you might be a COVID positive patient, how would we isolate you so that you would be safe, our patients would be safe, and our staff would be safe? Well, we actually ran simulations. We figured out exactly if somebody's going to walk in, this is how we're going to we're going to ask the questions we're going to ask them. We're going to make sure they have masks if they have positive answers to our questions. We're going to send them to an isolation room right away. We'll do our testing and then isolate them out through the office too. We also are really kind of careful of the number of people that came into our offices. We decided once COVID got here that we weren't going to be doing the routine visits anymore. In fact, if it wasn't a time-sensitive visit, we were actually encouraged our patients to not come to the office right now. Now, we took up something called telehealth, which has been exciting.
Yeah, telehealth, telemedicine. Tell us about that, because that's been around for a couple years, but a lot of people haven't used it. But now a lot of your providers are having interactions with patients through telehealth. What is that like?
You are kidding. It's great. I got to tell you, I talk to my docs and they're excited. Sometimes situations a little desperate allow us to do new things. We really weren't using telehealth that much within the medical group, but now I'll tell you that over 60% of our visits are with telehealth.
60%?
60% of all of our group. And our primary care doctors is more like about 72% right now. They love it. I think more importantly, our patients love it too. Sometimes we get to go out where you are, not even in unsafe times, but even safe times. Isn't it great to be able to talk to your doctor?
So we're all used to going to the doctor and waiting in the waiting room and having them examine us and all that stuff. But with telehealth, are there some things you can't do, or can most things you still get seen for?
So that's a great question. So the answer is sometimes you have to do a physical examination on someone.
Okay.
But not always. And as far as what we find is about 75% of the time, we can do a telehealth visit and complete everything we need to do. Those other 20-25% of the times we have to send them to our offices to be seen. And again, I don't expect that will change a whole lot even after all of this.
So sometimes they still need a strep test. Sometimes you need to listen to the heart, but many times you can do it on the telemedicine.
A lot of it's visual too. And the good thing about having video as part of not just a telephone, but having video conferences, I can see if you're breathing heavy and having problems, and I know I need to listen to your lungs, or I may need a strep test. I can't really tell by looking through a camera whether you need antibiotics or not.
So some of your physicians are also surgeons. Yeah. Now, were they able to keep doing all the surgeries that they did before? What happened with elective surgeries and your surgeons?
There actually was a big moratorium on elective surgeries here in the state of Florida. I will tell you, I'm very proud of our organization. We listened to the Surgeon General, who said you shouldn't be doing elective surgeries. Okay. We listened to our colleges that said you shouldn't be doing elective surgeries. What is an elective surgery
versus, because if it's a surgery on me, it's all important. Yeah. So what's elective?
Well, I don't know if I'd elect to have surgery.
Exactly.
So, yeah, an elective surgery is something that is, you can have it done, but it's not something that really needs to be done, or at least we can say non-urgent cases, not time sensitive. So it's not
Okay.
something that has to be done right away.
Okay.
And then there
So
are
like a knee, if you had a knee pain for 5 years, you're going to get a knee scope, maybe that would be an elective surgery?
that is absolutely an elective surgery. Now, it means you still seem to have pain in your knee, but it's not something we have to do tomorrow. We'd like it to do under safe conditions.
Okay, so we stopped those because the Surgeon General said, and also we were conserving masks and PPEs, but are we thinking about starting those up?
Yeah, we are actually. We're looking at it right now. We're working with the governor's office to see when he lifts the moratorium on elective surgeries right now, and we're looking very closely. It's a new day in surgery. It's going to be a new day in our offices, and we can talk about that if you like in a while too. But the new day is very important, I think. As a patient, I want to know I'm safe when I'm coming in. I also want to know as a CMO that all of my surgeons are safe. We will take a much safer approach to what we do when we start elective surgeries.
So I want to get back to elective surgeries, but we have a question from text, and it says, how will I know if it's safe to come back to a doctor's office? I'm getting that a lot personally. Scott, when can we go back to the urgent cares, the physician offices, and what are you doing to keep us safe?
That's, again, another great question. I think to keep you safe, it's going to be a new day in the office. Dr. Brady, you and I can remember that it used to be a sign of success of a doctor when you went into their waiting room and it was packed. Right? Boy, that's a successful doctor. They're doing really well.
Not anymore.
No, sir. No, in fact, I will tell you that's an unsafe doctor right now.
Okay.
We will be still looking at social distancing to make sure our patients are safe. In fact, our whole goal is to do away with as much as we can a waiting room. We will have virtual check-ins now where you'll be able to call and register virtually.
Okay, so people can register virtually and wait in their car.
And then they can register virtually, wait in their car. They can actually do all the paperwork. You don't have to, the first time you go to a doctor, you have all that paperwork you have to do when you go in.
Yep.
We're going to be able to do that online now too.
So they can isolate themselves, and when it's time to be seen, when they come in, everybody gets a mask.
Everybody gets a mask, gets their temperature taken, comes through our offices.
Okay.
And by the way, all of our people in our office wear masks for you too.
Yeah, so every employee is wearing a mask, the physician's wearing a mask, we give you a mask, and that really keeps a lot of the germs from going back and forth.
It does. I always tell people the mask doesn't protect you as much as protects others.
Yes. So now when they get in the waiting room, there's not going to be as many chairs, and they're going to be taken back to the exam rooms.
Right. Our preference is, when all possible, we would text you, say, come on into the office,
Yep.
and we're going to take you right to examination room 2. We'll put you in that office. We'll do whatever we have to do in that room.
And that room will have been cleaned?
Every room will be cleaned before and after, yes, sir.
Before and after every patient? Okay.
Absolutely. We have new decontamination protocols we're using now. They're even higher standard than we've always had high standards.
Okay, thank you for that. Okay, another question from Yvonne on Facebook, and she says, when we get back to our offices, will we be offered telehealth appointments? That's good. So when they get back, are your doctors and offices going to tell them that they can do telehealth?
Yes, they are. And actually, when you're calling to make the appointments, we'll offer you telehealth also. Again, a lot of our appointments can be done that way. We don't plan to go back on telehealth at all. In fact, we're looking at new packages right now that are even more effective for video.
So more and more patients are going to feel that combination where sometimes they'll be seen in person with their physician and with their labs. Sometimes they can be seen telehealth.
You're exactly right by that. And I think that not only are doctors like this, more importantly, our patients like this.
All right, let's go back to the surgery. So we said the elective surgeries over the next couple weeks are going to begin to ramp up.
Right.
From emergency surgeries to more elective surgeries. What are some of the things that we're doing before somebody would get surgery to keep everyone safe?
So I think lots of things, but the biggest one is probably starting to test our patients when they come into the hospital.
Test them for COVID?
For COVID.
Okay, how do they do that?
You can do that now with the spit test is the most common one. There also can do swabs in your nose. We're doing a lot more of those spit tests now. We have a lab we work with. It's a very sensitive test. And it's less invasive for a lot of folks too.
Sensitive meaning it's good at detecting if you have COVID.
It's darn good.
Okay.
And it's actually probably better than the swabs are now.
So before anybody gets surgery, they're going to do that COVID test. And if they test positive, they're not going to have an elective surgery.
No, they're not. In fact, I will tell you there's been some research recently that says even people who don't have symptoms but show COVID and have surgeries actually have a lot worse outcomes, can become a lot more ill.
Okay.
So we've been doing the right thing, and now we're going to make sure that not only the patient knows they don't have COVID, we're protecting them. We're also going to protect all our staffs and all the other people in the hospital, because if they're asymptomatic, we'll make sure we don't put them in a bad situation either, right?
So the staff are all going to wear masks. The surgery patient, they're going to get tested, and then even if they are negative, they're going to get a mask before they go in.
Right.
And then as we go forward, we're testing all of our employees as well and our physicians. In fact, we started physician testing today.
We did here in our organization.
Okay, and so if a physician tests positive, they're not going to be allowed to do that surgery.
And they're also not going to be able to work in their office till they're negative too.
Until they're negative. Okay. What are some of the other things, going back to the offices, what are some of the other things that will be new in this new world of hopefully post-COVID?
Yeah, I think, again, telemedicine was one of those big ones I think will still happen. We talked about the virtual check-in, bringing someone in. There's also a checkout in the room. So what you're going to find is that we're not going to let you sit out in the common area very much. We're going to move you through the office, because just like a hospital where there's ill people in the office, we really don't want you to be exposed to it. Not just COVID, but other illnesses as well. So you'll see a lot faster throughput once you get into your office. Into the examination room. That's where our time is. That's where our quality time is spent together.
Okay.
All that other stuff you used to spend outside, you'll now see we've expedited.
So AdventHealth has been working hard to elevate its game so that it's the safest place to be. And it needs to go above and beyond all the recommendations, and things like you're talking about allows it to be safe so people can be safe.
I agree with you. There's nothing more important to have the safety of each one of our patients and each one of our staffs and each one of our doctors too. We all want to be safe.
Now, here's a question from Patricia on Facebook. She says, my son and daughter are having twins in 10 days. Is it safe for me to visit them at home? Okay, this is good, because Dr. Cacciatore, along with being the chief medical officer, is an amazing physician, an OBGYN, and has delivered many babies, maybe even including your child. So let's go back to the clinical days. What do you say to the son and daughter who are having twins in 10 days? Should they be scared like they were a few years ago in H1N1? What is it like?
So I think the answer to that is make sure you don't have symptoms first and foremost. Or we're not asking you to isolate someone who's getting ready to have twins in the next few weeks. So
that's not elective surgery. Right?
No, it's not. And I'm not sure it's going to be surgery the other way too. We'll see how they deliver.
Right.
But the answer is, I don't know I'd isolate them completely like that. What you really need to know about them is when they go into the hospital, we're limiting our OB patients to one visitor. We know people really want to have a lot of support. We know that's really important during delivery, but you may find that it's a little more difficult to see them. You'll still have to do your own visits, your own televisits with them.
So when they're pregnant and when they're about to deliver, they go in the hospital, they get a mask.
Yep.
One visitor gets a mask.
Right.
And then the staff wears a mask.
We all wear masks.
Are they at higher risk delivering now than before COVID?
So probably a good question. There's a lot of asymptomatic people still
Okay.
with COVID, and pregnant women do that too. And that's why we're doing the mask and everything that we're doing in the hospitals. But besides that, maybe the better question is, are pregnant ladies at a higher risk compared to the rest of the population?
Right.
Because when we had H1N1, there was really a higher illness rate.
It was going to children and pregnant women especially.
Not right now.
But COVID is not.
Doesn't appear to be at all.
Okay.
Actually, it's been rather surprising, but our pregnant ladies seem to do very well with it.
So they need to take the same precautions as the general public, but not feel threatened in a different way.
Right, correct.
Okay, all right. So when they're delivering their children, is there any, if you have a mom that is COVID positive and she's delivering, does the child get COVID too?
They can. They actually isolate just a little bit as much as they can.
But not through the blood?
No, it's not through the blood. It's only through coughing and from the droplets that come out too.
Okay, so when they were first delivered, the child wouldn't have COVID,
No.
but maybe the mom.
No, there's been no cases of that at all. There's a couple of young children who had COVID, but they found out it really was from the droplets that came from the mother afterwards.
So when they come in to deliver, we're doing some testing to make sure that the moms don't have COVID.
That is right.
Okay, all right. We have a question from Brana on Facebook. My 81-year-old mother doesn't embrace technology. Okay, Brana. What options will a person have who isn't tech savvy?
Oh, that's a great question, Brana. We still have our folks that are there ready to see you, but we also have telephones, and a large percentage of our telehealth is actually telephonic.
You know, that's been that way for a long time, hasn't it?
It sure has.
Even for 30, 40 years, if you're talking to your doctor, that's kind of telemedicine.
And the other thing I'd like to answer for Brana, too, is that when we call in and we talk about doing this virtual check-in and stuff, we'll have people to be able to help folks do all that, too.
Okay.
So it's not a matter of we're just going to say, oh, you're not tech savvy, we're leaving you alone. We'll have folks to support that, too.
So we're going to walk the 81-year-old non-tech savvy person through this if they want to. If not, they can call us on the phone or come visit us.
You know, it's really funny, Scott. Some of our providers that are older, I wondered how they would embrace all this too.
Yeah.
I must tell you, my oldest providers are the most tech savvy I have. So I don't know I'd put everybody together of not being tech savvy
Really?
at 81. Yeah, oh, they're the best at telehealth that there is.
That's true. My mom's 85, and she's on the Facebook and the telemedicine whenever she needs. Here's a question from text: Is how is labor and delivery being handled? Can they support can the support person stay the entire time? So I'm sure they just heard you and said, "Wait a minute, can I stay with my wife?"
Yeah, there is one person's allowed to stay with that person on labor and delivery. It used to be we let several family members come and go. We're not learning that. We're only letting one person come in and out there. But yes, you will be able to.
Why are we doing that?
It's the same thing as do we know who is sick and who is not sick and who's being exposed. Again, the same principle as being in a waiting room full of people. That's not a place to be. We want a social distance.
Yep.
We actually don't allow a whole lot of providers in and out of, a lot of visitors in and out of our hospitals right now, but labor and delivery is one of those exceptions where we know support person is important in labor.
Now, when we were starting to reach peak, we had a no visitor policy that people couldn't come in at all. And now we are changing that soon to have one visitor.
Right.
Okay, so COVID is still present, but we're a little bit beyond peak.
Right.
Okay.
Thank God. Huh?
Absolutely. What do you see as the outlook for that? What is the next 6 months going to look like for your physician practices, for patients that want to see physicians?
You know, I think it's that new normal that we're going to talk about. We'll have a lot of social distancing in our practices. Again, you're not going to see much in the way of waiting rooms. Telehealth is going to be offered quite a bit. We are going to try to minimize unnecessary contact when needed, just like we should continue to be doing as a country right now. Even when shelter in place and everything is lifted, we really have to think about, do I need to be this close to this person?
So you and I are 6 feet apart.
We are, brother.
When we came in, we were wearing masks when we were around anybody, and masks are a fantastic thing.
And they'll go back after we get off here.
And we're making sure not to touch our face, staying 6 feet apart.
Washing our hands regularly, too. Other things we tell folks is don't forget, if you're ill, stay home. We don't want you at work when you're ill. And if you feel like you have symptoms of COVID, you know, we have folks you can call, talk to. We can get you seen in our offices safely. Especially, we like to know when you're coming, but we're prepared in case you are COVID positive and walk into our offices too. Remember, big rules. So like I said, wash your hands, don't touch your face very much, stay home when you're ill.
And those things really work, don't they?
Oh, look what's happened here in Orlando. We've done very well compared to where we thought we were going to be in this surge.
It's true. It's true. And if you've stayed home, thank you for doing that. You've helped keep the community safe. Here's the last question is, what will the new normal look like moving forward for the doctor practices?
So I hit it a couple times, and I hit waiting room on purpose because I think that's one of our biggest areas where we tend to put all our patients very close together.
So that word waiting room is probably just going to go away.
I would call it a virtual waiting room. And virtually be by yourself because you really don't need a whole lot of people in there. You'll see a lot more streamlining in and out of offices. You may even see consults that are telemedicine. If you come to see your primary care, maybe we'll be able to get that specialist to come talk to you right there in the office now, too, so you don't have to have that extra visit somewhere else.
Okay. It's a new world.
New world, my friend.
But we're keeping people more safe. We're streamlining their visits. We're still taking care of folks so they can feel comforted and can feel safe if they go to one of your practices, an urgent care, a hospital, or even a surgery.
Absolutely.
I mean, these are safe places to go now.
My family can come anytime.
Okay. Listen, thank you for joining us. We'll be back again on Thursday. You can learn more at coronavirussignsandsymptoms.com. Dr. Cacciatore, thank you for joining us today.
Dr. Brader, thank you for having me.
Okay. Good. God bless you guys.
God bless.